we are at a terrible place. We're seeing record numbers. We haven't even seen the post-Thanksgiving effects yet of holiday travel and gatherings yet. We should be seeing its effect in cases next week, hospitalizations, I guess, the following week. And the CDC is forecasting at this rate, we're going to see almost 20,000 COVID deaths Christmas week. Should people now cancel their travel plans for Christmas?
Yeah, I think they're going to have to make individual decisions, but I think we need to have, as a nation, seriously consider the things that we in the public health arena have been talking about of minimizing travel to the extent possible. Sometimes it's absolutely necessary, but to the extent possible, don't travel, don't congregate together. I know how difficult that is. We all have a strong degree of empathy, knowing, and myself included, about wanting to be with your family, wanting to have a large Christmas dinner with family and friends over. Right now, that just should not be done. To the best of our capabilities, we should avoid travel and avoid congregate settings. We're going to have, as I mentioned a couple of days ago, a surge superimposed upon a surge, because we already have that sharp incline that we discussed, Andrea, the last time I was on your show. We still have not yet seen what will likely be another blip of a surge following the travel and the congregating during Thanksgiving. Now we're approaching the Christmas season. The effect of Thanksgiving is going to be realized 2 weeks from now, literally as we're getting into the traveling season for Christmas and Hanukkah. So that's a recipe for some serious, as the CDC said, and I have to agree with them, we're in for a very, very difficult couple of months of December and January. Having said that, rather than just throw our hands up in despair, there are things that we can do about it. There are. I mean, you don't have to shut down the entire country, but there are 4 or 5 fundamental public health things that we all can do. The typical, and again, over and over again, universal wearing of masks, avoiding close contacts, and avoid congregate settings or crowds, particularly indoors, particularly when people are not wearing masks. That is a recipe for a real problem. If we could just do that, we don't have to lock down the economy over Christmas and over Hanukkah, but we can do some fundamental public health measures that will make a difference. Because when you compare countries or states or cities, one that does it, one that doesn't, there is a big difference. You can blunt some of that. In addition, as I've said many times, and it's quite true, that help is on the way. We're going to be giving vaccines towards the middle and end of December, and then more in January and more in February. So if we could just hang on and do those fundamental public health measures to try and blunt some of these surges, ultimately, we can get out of this. It isn't all despair, because we have public health measures that can help us, and we have a vaccine on the way. To me, that should be a motivation to double down even more and say, as difficult as it is, both from a personal and an economic standpoint, to not shut down, but to dampen the kind of interactions that you would have over the holiday, it will make a difference. It definitely will make a difference.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.